Hello everyone, welcome to my YouTube channel. Thank you so much for your excellent following and lots of appreciation. As you all know, I started my YouTube channel mainly to spread the knowledge in terms of health, education, and lifestyle. As a part of that initiative, today I'm going to discuss about one of the important parameter in our life, that is all about healthy aging. We all know that when we are in youth and childhood days, we don't have age related issues. But once we cross 50 years of age, there is no bar actually for that age limit. But generally, people treat 50 years as the boundary line. So once we cross that age, we do get some age related issues. And now that the technology has improved, now that the medicinal field has made a lot of advancement, we can definitely prevent all those age related issues with excellent planning. So what is that planning? How to overcome that age related issues? How to be perfect till the very end is our discussion topic. And I'm very happy to have Dr. Yamini Ajmera. She is mainly working in this area, and I am very proud to say that we have one of the expert who has established Vayodha Senior Care, which is one of the first India's initiative in terms of senior care, as well as Dr. Yamni has done MD in Geriatric medicine from AIIMS New Delhi. You all know how much prestigious institute is that, AIIMS New Delhi. Apart from that, Dr. Yamni is very much into the best practices in terms of senior care. So today we are going to discuss all those best practices in terms of senior care and how to overcome these age related issues. So thank you, Dr. Yamini, for accepting my invitation and attending this session. So can you please introduce yourself to my audience?
First of all, thank you for having me here. Hello, everyone. Namaste. My name is Dr. Yamini Ajmera. I have done my MD in Geriatric Medicine from AIIMS New Delhi, and I have been ex-senior resident also for 3 years in AIIMS New Delhi. And I'm a consultant geriatrician and founder of Vayodha Senior Care. So here we go.
Yeah, good to know, Dr. Yamini. So I wanted to ask, the first question from my side is, can we really prevent age related issues?
So yes, actually, that's a very good question because we have to understand aging is just not biological. Aging also improves, also includes biological changes, but it also includes lifestyle changes such as good quality sleep, active physical activities, social connectedness, emotional well-being. All these things are at par with medication when it comes to healthy aging.
Yes, Dr. Yamini, we are hearing about so many anti aging drugs. Are they really going to work? So, do they really exist and are they really going to work?
So there are many anti-aging drugs, many clinical trials that are going on, many research is going on. about anti-aging interventions, you might have heard about drugs like metformin. So metformin has shown some promising results when it comes to nutrient sensing pathways, very much involved in anti-aging, and it's but still this drug has not come in the market. Like we cannot prescribe it right now as anti-aging drug. Also rapamycin is another drug that is into the cards, but it has shown promise in combating sarcopenia. It increases uh, muscle health, but still the anti-aging part, more human trials are needed for these drugs to come into the market as anti-aging drugs. They are not approved yet.
So, Dr. Yamini, we are hearing a lot about longevity. So, can you please really explain us what exactly is longevity and how it is going to help an ordinary person?
So, longevity is an emerging field of medicine that improves your length and quality of life. It focuses on increasing not only your lifespan but health span. That is, number of years you are free of diseases. So, unlike traditional healthcare that is reactive, like symptoms are there, you find diagnosis for the disease and treat it. Longevity medicine is proactive and preventive healthcare based on scientific approaches. It focuses on improving your health span by personalized treatment plans, aging biomarkers, early aging biomarkers, and lifestyle interventions. So this is very like in nascent stage, but yes, that is the future of medicine that we are talking about.
So, Dr. Yamini, you spoke about anti-aging and anti-aging drugs. So, are they similar as longevity drugs? Are they different?
So, longevity does not only include anti aging drugs, it includes both medications like geroprotectors that we talk about. It includes pharmacological therapies as well as lifestyle interventions. It not only includes those like medications, lifestyle approaches such as good, like regular physical activity, balanced diet, good quality sleep, stress management, social connectedness, all these interventions are at par of like when we talk about health span, not only medicines. We have to believe that both these help in anti-aging.
Yes, exactly. So, regarding the diet plan and its association with longevity, so what kind of plan of action should everyone have in terms of diet plan so that every person can be perfect in terms of this longevity concept?
First of all, we have to understand that the balanced diet part that everybody hears what that balanced diet is. So balanced diet means like good quality food that enables healthy aging. That includes proteins, minerals, antioxidants, hydration. Hydration part is very important. And if you talk about the anti-aging part that our diet contains, so let me tell you, traditional Indian diets include spices that have anti-inflammatory and antioxidant properties. That is very much the component of many trials that are going like in overseas trials. Many of the components are included in the traditional Indian diet. For example, turmeric, its active ingredient curcumin, it is very much like anti-aging properties. Garlic has antioxidant properties. The seasonal fruits and vegetables, leafy greens like spinach and carrots, they have good like antioxidants and are like millets, bajra, barley, ragi. These have essential nutrients. Amla is very, like Indian gooseberry, it's a very potent source of vitamin C and antioxidants. And our lentils, chickpeas, even green peas contains spermidine that like works on a specific anti-aging biomarker. It promotes autophagy. So all these things, curd, for example, curd improves our gut health. So all these things we like they promote longevity, they promote uh, health span, and also they decline, like age-related decline. These ingredients not only prevent the age-related decline but also delays the age-related diseases.
Yes, Dr. Yamini, I have one point here. Like nowadays, everyone is focusing on exercises. So, what kind of exercises does uh, have impact on age-related issues, and what are the best practices in terms of exercises for especially senior citizens?
So mostly senior citizens, what they do is just aerobic exercises, walking. So they have to understand that is not the only thing that is going to promote muscle. You have to do progressive strength training with resistance bands, light weights. You have to do balance exercises along with aerobic exercises. Even 20 to 30 minutes every day of this progressive strength training can do wonders in your life. And we have to understand in elderly, the the intensity does not matter. The consistency matters. That is very important.
So, consistency in the sense, what kind of frequency should everyone maintain, Dr. Yamini? For example, in week we have 7 days.
Yes.
So, what kind of time schedule we should allot?
So 150 minutes per week, modulate intensity exercise. So it accounts to like 30 minutes, 5 days a week. That is the minimum that you need for maintaining your physical and cognitive health. And along with exercise, you have to keep in mind adequate protein intake and vitamin D should also be included in the diet.
So, Dr. Yamini, here the main concern is about muscle loss. So, most of the people have this issue. So, we heard that after 30 years, the muscle loss starts happening for everyone. So, how to prevent this muscle loss and how to overcome this kind of situation?
So, like I answered in your previous question, for preventing muscle loss, it's very important that you do like not only aerobic exercises but progressive strength training exercises, weight bearing exercises, balance exercises, like that improves your flexibility also. And these exercises, like not you don't need to go to a physiotherapy center always for these exercises. You can also like start home-based physiotherapy is also very much there. So if a person is not able to go outside to a physiotherapy center, they can start these exercises using light weights or resistant bands at home. And along with that, for preventing the muscle loss, you have to take approximately 1 to 1.2 gram per kg per day of protein in your diet. And vitamin D is very essential. Usually elderly don't go outside, they don't have that much sun exposure, and vitamin D levels are mostly like in a decreasing state in elderly. So we have to like take either you can supplement it through diet or take additional supplements. But yes, that is the key for maintaining your muscle mass.
Yes, Dr. So, the other related thing is all about the falls. So, mostly elder people they have the issue of falling because of this muscle loss or some other stress related issues, might be because of vision related issues. So how do we go for fall prevention strategies, Dr. Yamini?
So, fall prevention strategies for fall prevention. First of all, we have to know the cause of fall. So, fall can be because of many medical causes, like might be because of Parkinson's or dementia or arthritis. Okay, so and secondly, it can be due to many medications, even like simple blood pressure medications. Many patients use sleeping pills and orthostatic hypotension. Many drugs cause an orthostatic hypotension. So many medications, like even opioids for pain, if somebody is using, all these can lead to fall. So first of all, even like third will be cardiac causes, or like many causes can be there. Home hazards are there, like clutter is there in the house. So and the bed, like the washroom, if you are using like Indian style of washroom, and there is not proper lighting when you are getting up at the night. They are not, so many things are there that promote fall. So first of all, we have to identify the cause of fall, and for prevention, we can start by home modification, like installing grab bars in our bathrooms, handrails in the corridors, and we can, if the patient is like not able to go to the washroom, we can have like toilet seat assistive devices for like walkers, walking aids, and we have to get the vision and hearing checked regularly for elderly patients, because that is also one of the cause of fall. So yes, these are the main things that we have to keep in mind. And secondly, regarding the medications, it's very important that you reduce polypharmacy. There's a prescription cascade, like one drug is given to balance the side effect of another drug. Most common example is the hypertensive drug amlodipine. It might cause pedal edema in one patient. So for that, another diuretic is prescribed. So all these things have to be like taken care of by your physician, or I would recommend geriatrician. So these are very important to prevent falls.
Yes, Doctor.
Also,
Yeah, please.
I forgot to say. Also, like for like increasing uh, balance, you have to do balance exercises, weight bearing exercises, that are also very important. And in your diet, protein, calcium, vitamin D, take all these in your diet. And yes, this diet part also I want to focus upon, because many elderly in India are especially like undernutrition is very much prevalent. So we have to keep in mind for all this for fall prevention.
Yes,
Al-
Doctor Yamini.
Also, like sorry, last thing I forgot, in home modification, like if there is clustering in your house, remove unnecessarily like the things that are not for use. For elderly patient, we can remove that, especially the furniture, so that the elderly is able to go conveniently, roam around the house. Yes.
Yes, what you told is exactly correct. The main thing is lighting, the convenience, and also so many strategies you have explained in the best manner so that the fall prevention doesn't happen. And the other important concern is all about arthritis. So these senior citizens, they have the problem of arthritis. So Dr. Yamini, what kind of care we should take so that this arthritis doesn't happen? If it happens, how to handle it?
So, arthritis is highly prevalent in Indian population. It might affect up to 40% of the Indian population, according to studies. And arthritis, for like there are many modifiable and non-modifiable risk factors. So non-modifiable risk factors include age, female gender, and age, female gender, obese, uh, like ethnicity. So these things cannot be modified. Age cannot be like modified. It has to come. But when we talk about modifiable risk factors, obesity is one thing that we can take care of that can be modified because weight, like losing 10% of your body weight if you're obese helps with arthritis. Also, the strategies that if you're already having arthritis, then the strategies that help is weight bearing exercises. Weight bearing exercises and balance exercises and muscle strengthening exercises. Like if you're having osteoarthritis of knee, then quadriceps strengthening is very important. People believe that taking only analgesic drugs, painkillers, are going to help. That is not the case. Almost 50% cases get resolved with these exercises also. And for muscle, I've already answered this previously. For muscle building, you need exercise and diet, rich in proteins, calcium, vitamin D.
Yes, doctor. The other important thing I observed is mainly when people come to the age of 70 and 80, uh, we see that their backbone is totally bent in the sense uh, their way of standing is not erect, and they are very much grounded in the sense their backbone is not in the perfect shape. If we take the x-ray, we find that there is a lot of variation in terms of backbone. Especially, I'm mentioning this for those who are in the range of 70 to 80. So, how can we prevent this kind of issues, Dr. Yam?
So I think the main issue that we are discussing about is osteoporosis, because the stooping of posture is mainly we see in osteoporosis. Also, there can be lumbar spondylosis also because of low back pain, also because of decreased vitamin D intake, or even the intervertebral disc distance decreases. But when like the stooping posture mainly occurs in the disease called osteoporosis, and that is very prevalent in India. Like it affects almost 6 crore of the population here, and 80% of the cases are female, involve female gender. So if you're talking about the strategies to prevent osteoporosis, so yes, first of all, osteoporosis has many modifiable risk factors. So we have to stop smoking, limit alcohol use, and I've already talked about the weight bearing exercises, muscle strengthening exercises, vitamin D intake, calcium intake, up like the recommended dietary allowance is 1200 elemental calcium of 1200 milligrams, vitamin D intake of 800 international units every day, protein intake, and sun exposure. And also we have to keep in mind, if the patient is having osteoporosis, we have to incorporate fall prevention strategies that I've already talked about in my previous question, because all these things are very important. And yes, that's it for osteoporosis.
Yes, Dr. What do you think is the major challenge in geriatric medicine as far as India is concerned, especially for the rural area uh, citizens and the people who are unaware of this particular field?
So Indian geriatric healthcare is facing many challenges. It can be physician centric, like lack of trained geriatricians, lack of training at UG level, and lack of PG programs, patient centric because of low health literacy, socioeconomic disparities, high dependency rates, elder abuse, elder neglect, and most importantly, system and stakeholder level, like lack of geriatric specific infrastructure, policy and implementation gaps. There are lack of long-term care long-term care institutions, and all these get augmented when it comes to rural area because of poverty and distance. So all these things get augmented in rural scenario. But I believe solution is raising, first of all, raising awareness, and mobile geriatric healthcare clinics, and involving community healthcare workers in rural areas, public-private partnership, because NGOs also, I think, can play a role in increasing awareness, as well as taking, like, giving them access to healthcare in the rural areas. So yes.
So that way, here we have three important parameters like sleep, stress, and social isolation. So these are the major three concerns when it comes to aging. Especially, I see old age people, they get up lot many times in the night because of not getting proper sleep, and social isolation, stress because of retirement related issues, might be not getting engaged in multiple tasks. So all these affect senior citizens. So what strategies can we adopt so that they don't feel these kind of issues?
So thank you for this question, because we have to understand that social connectedness and stress management and adequate sleep, all these are very important when we are talking about health span and longevity, because all these things, like if you're not sleeping properly, if you're always like chronic stress is there, and you are not making meaningful connections, you are completely like socially isolated, containing to your home, all these things accelerate not only aging but age related decline. So these are like affect many hallmarks of aging. All these, if you're talking about stress, it not only like it uh, causes immunosenescence, like cellular senescence, DNA damage, telomere shortening, impaired autophagy. And when we are talking about stress, it leads to like decreased immunity. Sorry, if you're talking about sleep, it causes like cognitive decline, decreased immunity, and also social connection. Like if you're depressed, it causes like dementia also is related to social isolation. So all these things accelerate aging very much. So the solution for this is for like quality sleep, we have to maintain sleep hygiene. So sleep hygiene has many components. Most importantly is, if you're not able to sleep for like in your bed, don't just turn around. Get up, and after 20 minutes, if you're not able to sleep, you have to get up, take a round of your house, and then come back. And secondly, like after 6 p.m., you should avoid tea, coffee. Get your dinner by 7, 8 p.m. And yes, like go to bed at around 10 p.m. That is recommended for elderly. Caffeine, avoid caffeine. So there are many things that are there in sleep hygiene that should be followed. For stress management, chronic stress management, we should focus upon mindfulness practices. And for like social isolation, we have to make like meaningful social connections, go out. There are many like groups in the park also, like you can roam around with your friends there, and yes, make meaningful connections. So these things are very important. These interventions are at par with medical like medication interventions that we talk about to promote longevity and health span.
Yes, Dr. M. I wanted to know, is aging purely biological, or is it related to mental health? What do you say?
So, thank you for this question. Aging is not completely biological. The mental well-being, the emotion, like mental and emotional well-being, a sense of purpose, social connectedness, all these are very important when we talk about longevity. So I've already told you like how healthy aging can be promoted, like with diet, with physical exercise, with good quality sleep, with stress reduction, with social connections, and also laughter. Laughter is one therapy that people like don't usually follow. So we should laugh often. That all these things are like very much integrated into the zero protectors that the research has been going on, the lifestyle interventions.
Yeah. So that's really awesome, Dr. Yamini. So here, I wanted to know about the role of micronutrients and traditional Indian diets that play in healthy aging. What kind of specific foods that support longevity? Already you mentioned them, but I have a concern about Indian diet. So, is it going to support longevity? What do you say about it?
Yes, definitely. Our traditional Indian diet has many anti-aging ingredients. I've already told about turmeric, fenugreek, garlic, amla, Indian gooseberry, and chickpea, the basin that we use. And most importantly, earlier times, we used to have food cooked in home-based ghee. So that provides the like healthy fats, and the curd, kanji, the fermented foods like curd and kanji, they improve the gut health. So Indian also the seasonal fruits and vegetables, you don't get them like we get them here in India. We don't get them in many foreign countries. The fresh fruits and vegetables like spinach, carrots, and lentils, all our pulses, and most importantly, the spices. All these are like green peas also. So all these things have anti-aging properties, and you have to like keep in mind all the junk food that the generation is eating today. They they like very much deteriorate your health span. Like we should completely avoid junk food, the alcohol, the smoking, all these drugs, and also like the the traditional Indian diet should be promoted for anti-aging properties. And I think our forefathers already knew how to like increase the longevity part, but we have forgotten that. So I would like to ask your audience to start uh, like home cooked food, start incorporating home cooked food in their diet rather than going out and eating junk food that impairs their mental health as well as their cognitive health as well as their health span, overall health span.
Yes, Dr. Yamini. Finally, I wanted to know if somebody wants to invest in healthcare, especially for anti-aging, after that person crosses 50 years, what do you think the three practical steps should be?
So first, I would say get your baseline health screening done, including your metabolic markers like blood pressure, blood sugar, lipid profile, cognitive markers, and bone markers. Second thing, I would say that start the physical activity, like proper physical activity program immediately, and including like weight bearing and balance training and strengthening exercises. And third would be audit your daily routine, because trust me, your sleep, your diet, your stress, your social connectedness, everything is going to matter. So I think we should like all these things, if cannot be done all together, start with focusing on one thing at a time and increase the incorporate other things side by side, and that would do wonders in your life. Because at the midlife interventions, they they can improve the health span by many years. And I would like to conclude by just one thing: longevity investment equates to societal prosperity. Just believe that.
Yes, definitely. Thank you so much for your wonderful answers and awakening pointers. Before we conclude, I wanted to ask, you have set up Vayodha Senior Care Center, which is India's first senior care center. So, what was your objective? What were the challenges you faced? And what is the best facilities that are provided here?
Okay, so first of all, it's when I was working in AIIMS, so AIIMS caters to diverse population across India. So many of the people were not able to used to come and take medications for 3 months. So I thought that starting a more online, and I'm a consultant pediatrician, and by through this Vayodha Senior Care, I'm providing not only in clinic consultations but teleconsultation and home visits also in South Delhi region. So the most important thing that I had in mind was because elderly people cannot, many of them cannot come to the hospital or clinic. Also, the caregivers have time issues, because if you have to get your parents checked in a hospital, you have to either take full day off, because of the travel distance and because of the timing issues. So yes, I wanted to start something that helps with the basics of the elderly problems that I have faced during my 6 years of tenure in AIIMS. Like, give them accessibility to healthcare, and most importantly, quality healthcare. Because there are not many geriatricians that are doing private practice in India. So yes, teleconsulting, and thankfully, we are planning to expand Vayodha Senior Care to other cities of India as well, so that yes, the access to healthcare, quality healthcare, that that is available to senior citizens, and also everything is not like everything should not be money oriented. So I believe that there's a social responsibility also. So we are working on that also.
It's really great that you are doing a great job. Especially one point you mentioned is senior people cannot come long distances, and traveling is a very big concern, which we are really facing. And you resolved it in a excellent manner. I really thank you for this initiative. And the other important thing I wanted to ask you, Dr. Yamini, is like getting into AIMS is a big dream for everyone. So how did you make it? How did you make it? Any kind of tips for the newcomers who want to enter into it?
I think the only thing that I would like to inform newcomers is believe in yourself, because when I cleared NEET PG also, I was getting option in my home state Rajasthan and my home city Jaipur. But I during MBBS, I always dreamt of working in the best healthcare institute in the country, that is AIIMS New Delhi. And I feel blessed that I was able to achieve that dream. And for fellow MBBS students who are preparing for PG, I would say that just believe in your dream, focus, and perseverance is the key to success. Because if you start believing in yourself, world will start believing in you. That is the most important.
Thank you so much, Dr. Yamini, for sparing your valuable time. I know you are very busy. Even then, you have accepted my invitation and really given us valuable insights. I really thank you for your wonderful time.
Thank you so much for having me here, and I would like to say all the best for your future podcast. Thank you.
Thank you.